So today we're going to be assessing the alignment of our patient's back and of the spine. So just a background, this is what the spine looks like in your body. Up here would be like the thoracic spine, and down here is the lumbar spine. So for when we're palpating, we're going to be palpating the spinous processes here, as well as the transverse processes here. And you just want good alignment. You don't want them like kind of twisted up like this when they're just lying flat. And then when we palpate the transverse processes, they should kind of rotate like this. And as you can see with the thoracic spine, when you're on the spinous process, you'd have to kind of go up a little bit to find the transverse of the same segment. And then with the lumbar, it's a little bit closer. Down here, the lumbar, you just go straight across. So that was the spine. On the patient, to assess the alignment, you'd have them lying prone, and so here, you'd warm up your hands, and you would just go down the middle, and this is where you would find the spinous processes, and you could just count up, and you could just feel if they are in alignment. Ask the patient if they have any tenderness when you are palpating. And then, like I said, to find, so down here we're in the lumbar spine, and to find a transverse process, you would just go straight across and palpate there. And then you go on the other side, same thing. And you can do it at the same time, so that if I push on this side, you would be able to feel it come up into your hand on the other side because of the rotation. So now we're going to move up a segment and move across on both sides and just palpate there. And you might have to go a little bit underneath the muscles, because the second part here that we would be assessing is the myospasm of if there's any myospasm of like the paraspinals. And the paraspinals run along the spine on either side. They're just right here. So to palpate, you would just feel alongside and ask the patient if they have any tenderness there. You could assess if one side felt more prominent than the other, and that side might be in a muscle spasm. And if you also wanted to assess, you could have the patient just kind of try and lift their back up like that. Yep. And right there, now you can really see it. Okay, go ahead and relax. And so these muscles are just for extension of the back. And so if you're talking to the patient, you could be telling them that, yep, these muscles here help you bend backwards and give stability while you're walking and sitting, standing.